So prostate cancer is one of the most common cancers in men found over the age of 50. Cancer in general is an unregulated growth of an organ or cells. All right, so when cells grow and do not grow in a regulated manner, they can grow and spread and cause problems. That's what cancer is. Prostate cancer is when that happens to the prostate. Now, the prostate is a sexual accessory organ. It's pretty small, about the size of a walnut, but it can grow to larger sizes in other conditions. Some of the symptoms of prostate cancer could be urinary difficulties, erectile issues, but most commonly, unfortunately, is asymptomatic. So prostate cancer screening is actually very critical for this. So we screen men with rectal exams and blood tests to identify prostate cancer before it really becomes symptomatic, because oftentimes once it's become symptomatic, it's very difficult to treat. So let's talk about the difference between benign prostatic enlargement and prostate cancer. So there are really two different conditions that affect the same organ. Benign prostatic growth affects a lot of men over the age of 70 or older and causes a lot of urinary difficulties, specifically straining to urinate and things like that. And there's a lot of medications out there and a lot of surgical treatments available for men. And that's really different than prostate cancer. So a lot of men feel that if they're not symptomatic, they don't have prostate cancer, but that may not be the case. Prostate cancer is when you have unregulated growth of the prostate, and it's typically in the periphery of the prostate. That's why oftentimes it doesn't really give any symptoms until it's really quite advanced. So when the periphery of the prostate is involved with cancerous tumors, you may only feel it on a rectal exam or detect it on a blood test, but there can really be minimal symptoms associated with that. So years ago, people were really diagnosed with prostate cancer when it was in advanced cases. So they'd come in with pathological bone fractures, inability to urinate, things like that. Luckily, about 25, 30 years ago, we came out with a blood test called PSA. Now, with the advent of PSA, we have now begun to identify prostate cancers at a much earlier and typically curable stage. That's why screenings are very important. Typically, men are diagnosed in the curable or local stages, and they can be treated in any number of ways. Very commonly, we do surgical excision or robotic surgery, which has excellent cure rates with minimal side effects. There's also radiotherapy, different types of radiation, which include external beam, radioactive seed implantation, and cyberknife therapy. They're all accepted standards. They all have different side effect profiles. And over the last several years, there's been an increased use of something called active surveillance. So active surveillance means really waiting to treat until the cancer has grown. So there's really logic behind that. If you have a very low-risk cancer or if you're at very advanced age, you may be a very good candidate for surveillance. And I always stress to patients, surveillance does not mean no treatment. What it means is waiting to treat, observing it critically, and acting before it's too late. So unfortunately, even still with proper screenings, men occasionally slip through the cracks and are diagnosed in more advanced cases where they're really no longer curable. They're really not good candidates for surgery or radiation as curative treatments. But fortunately, over the last probably 2 to 3 years, we've had really dramatic improvements in treatment of metastatic prostate cancer. Typically, men with advanced cases undergo hormonal therapy, and eventually when that stops working, in the past there was really no other treatments. And over the last few years we've come out with very novel chemotherapeutic agents that are very well tolerated. There's also tumor vaccines, which are FDA approved for men with advanced or metastatic prostate cancer that no longer respond to hormonal therapy. And that's typically very well tolerated. So there are other tolerable treatments for even metastatic prostate cancer. So what I'd like to stress to men in my practice is how important prostate cancer screening is. It's a simple, readily available test that can be done on just about any man. And unfortunately, not every man gets screened. So still, just about every urologist I know still sees men with PSAs in the hundreds or even thousands. And that's such an easy thing to prevent with a simple blood test. And You may hear occasionally, oh, prostate cancer is slow growing, and that's typically true, but it's not always true. We still see very aggressive, very advanced cases all the time, and it's such a simple thing to test for, it's kind of silly not to. Simple blood test, simple rectal exam can really save a life, and that's the most important thing to remember.